And listen, if anyone needs in future any recordings of this, I'll also send that as well. Now, let's cover this up. If you have any questions, you can definitely post it in the comment box. And once this is done, or in between, if you have any questions, I'll definitely go ahead and answer those questions. I'll try to answer all your questions if you have any. And even after, like later, if you're watching this video and if you have any questions, my contact details are present in this particular video. You can contact me directly, or you can comment directly in the comment box, and I'll try my level best to come and give all your answers. Now, let's begin. Now, those who are beginning with, or like those who have not planned your examination, you've just started with your training, just for your understanding, speaking subtest is delivered individually and it takes around 20 minutes. Now, this part of the test uses material specifically designed for your profession, which means like if you're a nursing professional, then definitely the card will be related to your nursing profession. If you're a doctor, then definitely according to your profession. If you're a dietitian, physiotherapist, pharmacist, depending on your profession, you will get a card. The informations will be related to your profession. You will be able to comprehend it well. And the interlocutor, who's normally we call it as an examiner, is not actually an examiner in OET because he won't be providing any assessment. He will be just conducting this role play. He's called as interlocutor. Now, interlocutor plays as a patient. It can be a client or a patient's relative or carer. Okay. Now, before even we start get to know about what is speaking, we need to know what is assessment criteria. Okay, there are two different criteria. The assessment criteria is divided into two different parts. One is linguistic. Linguistic means language. Second is clinical. So based on clinical factors, how well you speak, how well you gather information. Are you able to understand the patient's perspective and then speak? So they try to understand your understanding, how much information you're able to gather first. Because unless you gather information, you won't be able to give out much information. It will be monotonous. You won't involve the other person into your communication, which is a bad sign, not a good sign. Now, if you check with linguistic, the first one is intelligibility. Intelligibility includes your way you speak, your pronunciation, how well you are able to pronounce words. Is it clear to the listener? So the patient is sitting in front of you. Every point which you try to clear to the patient, is it clear? Second is your fluency of language. Third one is your grammar and expression. We'll see one by one. I'll provide you a description of the top-notch band. And fourth one is appropriate language. Now, appropriate language means, see, now you need to understand this according to your real clinical scenario. When you talk to a patient, you cannot use medical jargons. You cannot use medical terminologies that they won't understand. If your role play card has terminologies which a person won't understand, you try to just copy that and repeat those terminologies, it's not going to be effective. It's not going to be important for you. And it may not be productive in terms of your scoring, because you will lose marks because the person who's sitting in front of you may not understand what exactly you're trying to say. So try to put it in simple words and simple sentences, appropriate register, tone, which is required when you're conveying the information. In terms of clinical, they will check like whether are you able to build a good rapport with the patient. Ask more questions. If you really want to build rapport with the patient, then make sure that you ask more questions. When you ask more questions, you will get more information. You'll build a rapport with the patient. So be ready with questions. And always have an attitude to understand patient's perspective. What patient wants to tell? What does he feel about a particular procedure? What does he feel about the management? Like certain times you get case notes wherein patient would be going back home. He doesn't know will he be able to manage himself at home. So you have to understand the patient's concerns. Many times people take it as a simple task wherein like there is a task given to me. I just need to read it, understand it, and then speak. It's not that way. Take it as a real patient and a nurse scenario where you're talking to a patient. When you try to enact in that way, that you really feel like I'm talking to a patient in a natural setup, you will score the maximum. Because over there, you will try to show that I really want to come here and help you. So you will try to know what are the concerns. Then you will have to make sure the introduction, first you have to introduce very well. An appropriate structure should be followed. There should not be a confusion to the patient. You should not be the only one who just continuously speak. You're not even stopping in between to ask questions. You're not even sure whether the person is understanding, then you lose marks. So go according to a structure given. Then gather the information well, ask more questions. Like for example, if you want to explain the patient about exercise, then make sure you ask him about the routine, what he has in his day-to-day life. Like, is it like the day when he starts, like as he tries to involve in exercises, what's his normal routine, what kind of exercise regimen he follows? Try to get those informations. Once you get that, then you will be able to give out information. If these points you keep in your mind, these assessment criteria you keep in your mind, things will be easy. Like the first one, linguistic criteria. They check with your pronunciations, your stress, intonations. Intonations means like you raise your pitch and lower your pitch based on the kind of information what you're giving. If you're asking a question, it should sound like a question. This is very important. Fluency, which means completely fluent speech at a normal speed. So do not increase your pace. I keep on telling my students when they do speaking with me that control your pace. Because pace needs to be well controlled. The person who's listening to your recording, even in the real scenario, when you're talking to a patient, the patient should be able to understand your speech. This is very important. It shouldn't like you keep on fumbling when you're speaking. That shows that you're searching for words. You don't have good lexical resources. That will even pull down your score. Appropriate language, as I told you, make sure you're talking to a layman, a common man who may not understand medical terminologies. Try to put it in simple words, which is required. And your grammar and expression, which need to be rich and flexible. Wide range of grammatical and vocabulary should be used accurately. And you should be confident enough to speak. That's your assessment criteria in terms of linguistic. Now, if you go for another one that is clinical, it includes, they check for whether are you able to initiate relationship building. That is rapport building. So initiating the interaction appropriately, are you able to greet? Are you able to introduce yourself? It should seem like an interview. When a person listens to you, it should seem like an interview. So you need to make sure first you introduce yourself. The introduction needs to be clear. They will check whether are you able to are you able to elicit and explore the patient's ideas. You will have to understand what kind of expectations patient has from you, what kind of information he wants to know. That is understanding the patient's perspective. Third one, as I told you, providing structure, which means whether are you able to sequence your introduction, then you go to the task and then you conclude. Is it purposefully and logical? Information gathering, I told you, gather as much as information. You have to use active listening techniques wherein you need to listen and minimize your interruption. Many a times it happens, like we are ready with the dialogue. Sometimes we look at the role play card and we feel like, oh, this is such an easy task. I can speak on this. My experience comes from this department. So I handle patients every day. So let me go ahead and nail it. Sometimes that may be a wrong approach. Even if you know the answer, what is the next answer that you need to give? Try to minimize the interruption and make sure you enhance your listening technique. Because your speaking examination is not only an examination which will assess your speaking ability, but it also checks your listening ability. How actively you are listening to the patient. And then give out the information. Okay, this is what is required when you are doing your speaking. Now, I'll just quickly go through the structures. Then at the end of the lecture, I'll tell you what are the 5 key points that you need to keep in your mind. Now, part A is a very good opportunity given to you. It'll run for around 4 minutes. You can ask some questions related to they will ask you some questions related to your profession to make you comfortable. So make sure that you utilize this particular time. Make sure that you utilize this and use this time to build a good rapport with the examiner or interlocutor. Because this is the time you can take away your worries, you can take away your anxiety. Try to be calm, try to think that this is a real situation. I'm talking to a patient, and accordingly, you need to respond. Part B is all about a role play card, when the preparation time is 3 minutes and the speaking time would be 5 minutes. Part C would be a second role play card, wherein again the preparation time would be 3 minutes and the speaking time would be 5 minutes. And this is how the role play card looks. So there are certain factors. When the role play card is given to you, you get complete 3 minutes. So make use of it. First, look at the setting. The setting clearly says it's about where are you sitting right now, which is your environment. You're sitting in a suburban general practice. Then it gives you an explanation of the scenario, where it may elaborate more about the diagnosis, elaborate more about the situation, and then look at the task. Now, when you're looking at the task, always pay attention to the first word, which would be a verb, which tells you what you have to do with the task. Pay attention to the first word of the task, which would be a verb, like explaining something. It's an action. So this gives you a clear indication what action you need to take with each given task, like explain, reassure, outline, treatment, or advice. So you know whether I need to upfrontly give an advice, whether I need to elaborate more, what I need to know. Reassuring patient is a very important factor, where you need to assure whatever you are giving out the information, the person is clear about it, which is very important. And once you're done with everything, you need to make sure that you conclude as well. So speaking structure is divided into 3 parts, which includes introduction, body, and conclusion. When you get those 3 minutes, how you need to plan. So plan your introduction. The introduction has got 4 elements, which is greeting. First, you greet the person, good morning or good evening, depending on the time. Then you elaborate your name. I've written my name, you can add up your name. My name is George, and your designation as per the card. If it says you're a GP or a doctor, GP, dietitian. If you're a pharmacist, then pharmacist. So as per the demand of the card or what is written, and as per your profession, you will give your designation. And then the final one would be offer to help. If you already know the patient, like he's your own patient, you will say, how are you doing today? How may I help you? You look anxious. May I know the reason? May I know your name? First time someone coming to you, how may I help you? You don't know the name, how may I address you? So these ways, you can try and experiment your own offer to help. It has to sound natural, which is very important. When you join these 4 elements together, that becomes your introduction. Then we have body, wherein we move through each and every task one by one. As I told you initially, you have to make sure that you perform each and every task, pay attention to the first word of the task. The first word, which is a verb, which is an action, which will tell you what you have to do with the task. This will make your job easy. You know what you have to do with the task. And it's always better, use a pen and paper and make some notes, make some points before you speak. So it shouldn't happen that midway, you search for words and you search for sentences. Try to avoid that. And after everything has been done, once all the tasks you have spoken, make sure you conclude. So I believe I've answered all your questions. If you need any further clarification, please do not hesitate to contact me. This is one of the ways. Otherwise, you can review all the points. What you have already given out the information, what you've already spoken, you can review all those points and summarize your talk, which is very important. So provide a proper structure if you want to score grade B and above. A is also not that difficult. Make sure provide a good structure, introduction, body, and then conclusion. Okay, now let's go into key 5 points to remember before you start speaking. Now, the first one, how does the patient feel or a family member feel about the situation is very important. Try to avoid more authoritative language. Try to avoid more of negative language. Try to use as much as positive language you can use. Like example, if you tell a person that you're going to undergo surgery, patient may not feel much better. You will be admitted in the hospital for 5 days. Patient may feel sad. You will be put on antibiotics for 5 days. There may be a patient who doesn't like medicines. How can you convert this into a positive language? You can say, the surgeons at this hospital are incredibly experienced at this sort of procedure, and you will be in the best hands. So you're trying to tell the patient that don't worry, everything is in control. You know, patient needs to be admitted and patient knows very well that I will be admitted, and you're telling him that you will be going back home within 5 days. That sounds more positive. Or else we say after 5 days of medication regimen, we would observe the progress. So he knows that, okay, after 5 days, it's going to end. So try not to be more authoritative when you're speaking. Try to put it in a positive way. Now, if you're explaining a procedure in your role play card, make sure, example, insulin administration regimen, very common factor in most of the role play cards. Make sure, ask first of all, any points he's already aware about the procedure. So first you gather some information. Don't directly start, okay, let me go ahead and explain you how do you administer the insulin regimen. That's not a right approach. First, try to know what the other person wants to say. Once that is done, you can use words like when you begin to explain, the person should know which is the first step, which is the second step. So you can use words like firstly, secondly, or lastly. It will provide a clarity to the listener, and he'll be able to remember the points well. And in between, take reassurance that the person is following you, that the person is understanding. And when you're explaining a procedure about a medicine, like for example, very common anticoagulation medicine, you have to put it in simple words like blood thinning medicines. So try to make sure, explain it as simple as possible and make sure the patient understands what you're trying to say. Third one, listen and respond. Don't be in a hurry to respond. Wait, let him finish. Do not interrupt. It's always like I told you earlier also, it's tempting to plan your dialogue in advance and be ready for the task. Some people feel like I know answers for all these tasks. I will just give it all the answers and I'll just finish it off quick. No, you won't get the points. Try to go slow, listen, let them finish, and then you respond. Okay, this is very important. Okay, and in between, when you're listening, if you're using words like okay, I understand, at the right place, that shows you're listening, you're actively listening. Because if you just nod your head, your speaking is going to be recorded. The person would be listening to your speaking. He doesn't know, are you responding or not? But these words can definitely let the examiner know that you're listening actively, you were listening actively, and the responses says that clearly. This is very important. Fourth one, learn to offer advices. You have to offer advices in such a way the person should feel this is the best advice I'm receiving. Words like I highly recommend. It would be a good idea to start with exercise regimen. I strongly suggest that. My advice for you is to. It's important that. So these words strongly recommend this is the best piece of advice what he or she can get. So these words can be used when you're doing your speaking. And end by summarizing. You need to summarize by highlighting the key points or by reassurance. Example, I believe I've answered all your questions, and if you need any further clarification, please do not hesitate to contact me or my department. Well, however it is, you can definitely start it that way, no problem with that. No. So that's how you need to do it. Make sure that you continue with this, follow these techniques. This will definitely be helpful. And any questions in future, when you watch this video and if you have any questions, you can definitely come and comment over here, or else you can contact me directly and I'll make sure that I answer all your questions. Thank you so much for joining in, guys. Have a beautiful evening. I believe this was productive. For more such lessons, make sure you like our page, share it with your friends, and keep a check on this page. We will be updating more lessons on different modules as well. Thank you so much for joining in. Have a beautiful evening. Bye, people. Take care.